The top stories tonight in Y News. More coronavirus disease infections are starting to spread in places outside of Metro Manila, with the government eyeing 9 more areas to place under alert level 4 should COVID-19 conditions escalate.
Presidential Advisor for Entrepreneurship Joey Concepcion has recommended to the IATF the gradual phase-out of facility-based quarantine for international arrivals.
Vaccine expert warns the public against deliberately exposing themselves to COVID-19 infection to get immunity.
2 Nigerians and 3 Filipinos have been arrested for their alleged involvement in the hacking of more than 700 BDO accounts last December.
Good evening, Philippines and the world. Today is Friday, January 21, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. Emangelo Castro III.
First in the news, Malacanang says 9 more areas in the country could be escalated to alert level 4. Meanwhile, returning overseas Filipinos who have recovered from COVID-19 but still tested positive for it can now enter the Philippines subject to protocols. Rosa Dicos explains why.
Acting Presidential Spokesperson and Cabinet Secretary Carlo Nograles revealed that the Interagency Task Force for the Management of Emerging Infectious Diseases, or IATF, is strictly monitoring the areas of Bataan, Iloilo City, Ormoc City, Naga City, Dagupan City, Western Samar, Tacloban City, Biliran and Zamboanga del Sur, which may be escalated to Alert Level 4. This if the COVID-19 situation in these locations escalated and local government units will not do the necessary adjustments on COVID-19 bed capacity.
So ito yung minomonitor natin ngayon. But if hindi nila kayang gawin or mas lalo pang tumaas between today, tomorrow, and the next days, gaya ng sinabi namin, we will not hesitate to escalate to alert level 4 kung kinakailangan.
The palace reiterated it is up to the concerned local government units to increase the number of their dedicated beds for COVID-19 patients, or else a shift from alert level 3 to level 4. Malacanang explained before that having a COVID-19 bed utilization rate between 71 to 84% would lead to the declaration of alert level 4. Currently, 4 provinces are under COVID-19 Alert Level 4 starting today until the end of the month, particularly Kalinga, Ifugao, Mountain Province, and Northern Samar. Meanwhile, the government's pandemic task force has allowed the entry to the country of overseas Filipinos who have recently recovered from COVID-19 but still tested positive for it. However, they are subject to strict protocols. They should present positive RT-PCR test that was taken within 48 hours prior to the flight, a medical certificate issued by a licensed physician. Another positive PCR test taken not earlier than 10 days but not later than 30 days prior to departure from country or port of origin. Upon arrival to the Philippines, the passenger will be required to observe facility-based quarantine protocol applicable to their country of origin and vaccination status. If the passenger is fully vaccinated and is coming from green list territories, he or she shall be required to undergo facility-based quarantine prescribed for yellow list territories. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
More COVID-19 infections are now starting to spread to the provinces despite the steady decrease of infections in Metro Manila. Aiko Miguel will tell us why.
OCTA Research Fellow Professor Guido David reported that from less than 4,000 cases on January 12, COVID-19 cases spiked to almost 20,000 yesterday in areas outside NCR. This is equivalent to 200% increase in 8 days. Professor David further explained this is somehow not surprising as Omicron has spread out like wildfire in other parts of the country. In Cebu City, David projected that new COVID-19 cases may peak at less than 1,000 cases. Meanwhile, in NCR, COVID-19 cases have decreased, and by February, it will even go down to below 1,000 per day.
Even by the end of the month, we're projecting, maybe just a little over 2,000 cases per day in the NCR. I mean, it peaked at around 80,000. By Valentine's Day, it could be at less than 1,000 cases. And by the end of February, it could be at around less than 500 cases. Again, these are very rough projections. We hope it can be used to guide some of our friends in the business sectors and even in the government.
Professor David added the decrease in new cases in the NCR is nearly as rapid in South Africa. To sustain the rapid increase, Professor David suggests that the alert levels should not be downgraded until NCR reaches moderate risk.
Downgrading to alert level at this time might not be advisable until the NCR reaches moderate risk, just to sustain the rapid decrease that we're seeing so that we could see those good numbers later in the months of February. Last year, we almost reached a baseline of about, I think, less than 100 cases per day in the NCR.
The Department of Health also observed the same situation in NCR, but some metrics have to be considered to conclude that NCR is already experiencing a downward trend in COVID-19 cases.
Base po dito sa obserbasyon na to, atin naman pong sinasabi na oo, bumabagal po ang pagtaas ng mga kaso. Meron po tayong nakikita na parang nagpa-plateau dito sa National Capital Region. But we do not only look at the number of cases. Kapag po tayo ay nag-aanalisa ng ating sitwasyon, tinitignan pa rin po natin yung iba po nating mga metrics na ginagamit. Katulad po ng positivity rate.
The DOH said that they have to ramp up the vaccination coverage in areas outside NCR to prevent rapid spread of Omicron variant transmission and save the vulnerable population from death and hospitalization. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Department of Health, or DOH, has recorded 32,744 new cases of novel coronavirus disease, or COVID-19, pushing the nationwide case count to 3,357,083. Majority of the cases were still detected in Metro Manila, Calabarzon, and Central Luzon. The new cases pushed the number of active cases across the country to 291,618. Of these, 277,833 are experiencing mild symptoms. There are 9,015 patients who have no symptoms, 2,979 are in moderate condition, 1,487 are severely ill, and 304 are in a critical state. The DOH also reported that 16,385 more patients were able to beat the viral illness. This brought the total recovery tally to 3,012,156. The death toll, however, climbed to 53,309 after 156 more patients have died. Meanwhile, the overall global COVID-19 caseload has topped 342,684,472, while the deaths have surged to 5,574,860, according to the Johns Hopkins University. The United States is still the worst-hit country with the world's highest number of cases and deaths at 69,308,600 and 860,248, respectively, according to the CSSE. And in terms of infections, India follows with 38,566,027 cases and 488,396 deaths. In terms of Brazil comes second with 622,476 fatalities and 23,595,178 COVID-19 cases.
Presidential Advisor for Entrepreneurship, Secretary Joey Concepcion, suggested to the Interagency Task Force for the Management of Emerging Infectious Diseases the gradual phase-out of facility-based quarantine protocols for international arrivals. Janice Inhente explains why.
The Philippine economy will be left behind by other countries if it will still remain stagnant due to the existing quarantine protocols, according to Presidential Advisor for Entrepreneurship, Secretary Joey Concepcion. Concepcion pointed out that most of the businesses affected by the current restrictions are airline companies as well as hotels and restaurants, which also have limited operations for over 2 years due to the pandemic. He reiterates his call to the government to revisit and study the COVID-19 quarantine protocols and reflect on current developments in hopes to reconsider gradual phase out of COVID-19 containment policies.
As we see Omicron start to subside, then maybe we can move towards a gradual phase out of our quarantine in the country. We will really try to engage with the IATF on starting to study this whole gradual move towards the removal of quarantine. We can't continue to lock ourselves out. We can't continue to restrict movement. We definitely have to open up the economy.
Concepcion added that the country should already move from enforcing a facility-based quarantine to home-based quarantine.
We're not also suggesting that we implement the no quarantine immediately. What I'm proposing to our IATF members is that a gradual move towards, to me, the removal of quarantine in the Philippines and moving towards home quarantine rather than facility-based quarantine, because my own view is that it has not actually helped us from preventing Delta or Omicron from entering the country.
Concepcion based his proposal on what is being done in other countries such as Thailand, Switzerland, and the United States, where quarantine is no longer mandatory, especially for fully vaccinated people, and their constituents are almost living a normal life.
But we should think about it. I believe that eventually, yes, you have seen in the news, Thailand, Switzerland has started to open up. No, some of them are removing their quarantine and seeing how people are coping with COVID-19 in America and specifically in the Bay Area. I've noticed that but basically everybody is wearing masks. They are definitely conscious about the need to prevent themselves from getting sick, but they live a normal life. No, there's a lot of movement, and people have accepted that.
Meanwhile, according to acting presidential spokesperson Carlo Nograles, the proposed phase-out of quarantine protocols needs to be carefully studied because not all implementations in other countries are also applicable in the Philippines. The presidential spokesperson explains that all implemented protocols are required in accordance with the recommendation and scientific basis of health experts.
Lahat ng mga suggestions naman po ay pinag-aaralan natin sa IATF, no? Then of course, tinitingnan din po natin yung mga ginagawang practices ng other countries. We benchmark also with the practices of other countries. But we're also mindful na dapat it's not a one-size-fits-all for all countries. Kailangan tingnan mo kasi yung konteksto, no, ng bansa. Siyempre, base rin po sa mga suggestions, recommendations sa mga health experts natin. So lahat based on science and data.
Janice Enhente, UNTV, News and Rescue. We serve the people, we give glory to God.
A vaccine expert warns the public against exposing themselves to COVID-19 infection. Eileen Cerudo will tell us why.
A deliberate exposure to COVID-19 infection may do more harm than acquiring a natural immunity against the virus. A new study showed getting infected with COVID-19 might boost a patient's immunity. Getting vaccinated combined with natural immunity can also further protect an individual from having a severe case of COVID-19 infection. However, vaccine expert panel head Dr. Nina Gloriani discourages the public to neglect following minimum health standards and expose themselves to COVID-19.
Base sa pag-aaral, totoo na ang natural immunity plus vaccine immunity yung tinatawag nating hybrid immunity ay mas mataas ang level ng mga, let us say, neutralizing antibodies. Pero I don't think the doctors will say na yes, magpa-expose kayo para magkaroon kayo ng natural immunity. Hindi po ganon.
Breakthrough infections also vary from mild to severe depending on the situation and health status of a fully vaccinated individual.
Mabuti kung ang breakthrough infection ninyo ay mild, hanggang moderate siguro, pero mild, pero magkakaroon kayo ng boosting ng immunity. Pero kung maging severe yon, hindi yun maganda. So hindi natin titignan na ang magpapa-infect na lang tayo, hindi po ganun yung mangyayari dapat.
Studies also show possible long-term effects of COVID-19 to an infected individual, so a deliberate exposure might not be ideal to get protected.
Sa kaso ng COVID-19, ay ibang-iba po itong sakit na ito. Ngari, mahawa ka sa flu or sa colds, common colds, gagaling ka kaagad. Pero sa COVID-19, hindi tayo sigurado ano ang magiging natural course ng ating infection.
The public, including fully vaccinated individuals, should still protect themselves by following minimum public health standards. Dr. Gloriani also appealed to unvaccinated individuals to accept any brand that is available and avoid having any preference. She assured all brands of COVID-19 vaccines are proven to be effective in providing additional layer of protection. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
5 individuals, including 2 Nigerian nationals, are now facing complaints over the recent video hacking incident. Dante Amento tells us why.
The National Bureau of Investigation or NBI Cybercrime Division has arrested 5 individuals allegedly involved in the account hacking of several BDO depositors last December 2021. The subjects are identified as Ifisinachi Fountain Anekwe, alias Daddy Cham, Chukwemeka Peter Nwadi, both Nigerian nationals and believed to be members of Mark Nagoyo Group. Meanwhile, the 3 Filipinos, namely Jerome Anthony Taupa and Ronilyn Panaligan, Clay Reveliosa, allegedly served as web developers and downloaders. The NBI says the 2 Nigerian nationals were engaged in the business of providing access devices to anyone looking for options to cash out in a fraudulent manner.
The 5 has already been requested. We have already informed our International Operations Division to kindly inform the embassy of the foreign nationals arrested.
The NBI Cybercrime Division has conducted an entrapment operation which resulted to the arrest of the foreign nationals in act of offering accounts for sale. The NBI added the suspects in BDO hacking have used phishing emails and sent them to the depositors to get some information.
Nag-send sila ng mga phishing emails. Nag-gather nila, na-harvest nila yung mga information provided by the depositors. Hindi were able to generate yung OTP, one-time pin. So, na-bypass nila yun, and they ultimately were able to transfer the funds from depositors.
The Nigerian nationals are already subjected for inquest proceedings in violation of the Trafficking in Unauthorized Access Devices under Access Devices Regulation Act of 1998. The NBI also assures to monitor the other members of the heist group to make them accountable. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
The Philippine National Police assures its full cooperation in the prosecution of the murder case against 9 policemen involved in the ambush of former Calbayog City Mayor Ronaldo Aquino and his companions. Leia Ilagan reports.
The Philippine National Police respects the decision of the Department of Justice to file a murder case against the 9 policemen involved in the killing of Calbayog City Mayor Ronaldo Aquino and 3 others last March 2001. PNP spokesperson Police Colonel Roderick Augustus Alba said the PNP will cooperate to the DOJ and assures the availability of the involved policemen during the hearing.
PNP Chief General Leonardo Carlos assures full cooperation in the case, in the same manner that the PNP respects the rights of every party involved.
The PNP has dismissed from service some of the policemen involved in the killing. These are Police Lieutenant Colonel Harry Villar Sucaire, Police Major Shairil Tan, Police Staff Sergeant Neil Cebu, and Police Staff Sergeant Edsel Tan Omega. The other police personnel that were charged with murder were Police Captain Dino Goles, Police Lieutenant Julio Armeza Jr., Patrolman Nino Salem, Police Corporal Julius Garcia, and Police Staff Sergeant Rande Merelos.
Bago pa man makasuhan ng DOJ, the PNP has already dismissed 4 of the 9 respondents upon recommendation of the Internal Affairs Service na nakakita ng mabigat na ebidensya laban sa kanila.
On March 8, Aquino and his companions were killed in what the police claimed to be a shootout along Laboyao Bridge in Barangay Lunoy in Calbayog City, Samar. Based on investigation, however, the incident was found to be an ambush perpetrated by the cops. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
The National Grid Corporation of the Philippines clarifies that there is enough power supply throughout the year, but rotational power interruptions may still occur during the election period. Asher Cadapan Jr. tells us why live. Asher, go ahead.
Jaga, the National Grid Corporation of the Philippines warns of thin power supply in the country during the dry season, as demand is also anticipated to increase due to warm temperatures. But what the NGCP fears more is the emergency maintenance that power plants may render. NGCP spokesperson Cynthia Alabanza says such incidents may force the implementation of rotational power interruptions during the upcoming presidential elections in May.
Wala tayong projected base dun sa schedule na mga maintenance ng planta. Historically, nakakakita tayo ng mga unscheduled o yung biglaang pagtirik ng planta. Yun ang, pag sila'y nagsabay-sabay, kahit on paper sapat, may posibilidad talaga na maglayag uli kami ng alert status or worse, magkaroon ng power interruptions.
With this, the NGCP calls for the authorities and the public to come up with measures in managing the demand side to ensure adequate power, especially during the election period. The privately owned company says this is the only immediate resolution they may recommend to avoid power interruptions.
Kasi nga po kung ang problema nyo kanipisan ng supply, ang either po dagdagan natin ng supply o bawasan ng gamit. O at least maging mas efficient ang gamit. Since medyo late na po tayo magdagdag ng power plant at ang gestation period ng mga power plants nasa 3 to 5 years, ang only option talaga dito is demand side management.
The NGCP, however, still recommends building more power plants as a long-term solution in the challenges in power supply. The transmission service provider explains that more supplier also helps lower the power rates due to high competition. Energy Secretary Alfonso Cusi, on the other hand, raises concerns to NGCP regarding the recurring problem in power supply. But NGCP explains that they are coordinating with the Energy Department to clarify the said concerns. As they explain, they are only limited to the transmission of power from suppliers to the distributors. Diego.
Thank you, Asher Cadapan Jr., reporting live from Quezon City.
Meanwhile, Vice President Leni Robredo is open for amending certain provisions of the Constitution. Meanwhile, Ferdinand Bongbong Marcos and Davao City Mayor Sara Duterte tandem push for the establishment of modern trading post. Nel Mariboc reports.
Vice President Leni Robredo attended the presidential forum organized by the business sector. Robredo said she is open to the idea of amending the economic provisions of the Constitution.
I am very much open to exploring any proposed constitutional amendment that would unlock current roadblocks that are thrown our way, as long as we ensure that the process is open, transparent, and people are given the opportunity to participate.
But for now, she wants to push for a responsive Philippine Public Service Act that will open the economy but will also assure the necessary safeguards. In a news release, Ferdinand Bongbong Marcos and Davao City Mayor Sara Duterte Carpio want to build more modern trading posts to provide Filipino consumers access to more affordable farm products. The two also emphasized that the improved supply chain would also positively impact the environment apart from the benefits of lower price of goods. Leo de Guzman in a forum expressed his opposition in several policies of the government. These include the implementation of no vaccination, no ride policy and the plan of the Department of Education to expand the limited face-to-face classes next month.
Tingin ko, Neil, hindi pa dapat dahil pataas pa ng pataas yung bilang ng COVID at delikado yung ating mga kabataang estudyante.
In his FB post, Senator Panfilo Lacson warns the public against the proliferation of text scam. He advised not to easily be trustful to unknown cell phone numbers. Lacson said through the national ID and SIM card registration, thieves could easily be identified. Senator Manny Pacquiao calls on the Department of Agriculture that the agency should look for ways to help the fisher folks. This is to avoid resorting to importation of fish supply where corrupt government officials and businessmen are the only ones who benefit from it. Pacquiao said the Philippines has a vast potential to become one of the world's leading marine and aquatic products providers because of its strategic location in the Pacific Ocean. In his video message, Manila Mayor Isko Moreno Dumagoso presented some of his plans if he becomes the next Philippine president.
Habang hindi pa tayo nakakabawi at hilahod pa sa pandemya, tuloy-tuloy na ayuda sa bawat pamilyang Pilipino. Ani ng mga magsasaka, bibili ng gobyerno sa tamang halaga.
Aside from this, he also wants to slash the taxes imposed to petroleum products and electricity. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
The National Task Force Against COVID-19 sees commercial availability of COVID-19 vaccines in pharmacies by the year 2023. JP Nunez reports why.
The national government is anticipating that manufacturers of COVID-19 vaccines will soon apply for commercialization of their vaccines. National Task Force Against COVID-19 Chief Implementer Secretary Carlito Galvez Jr. projects this may possible by next year. Manufacturers are currently focused on selling their vaccines to the national government since it is easier to only transact with one party.
We will see it maybe 2023. Sa ngayon, when we talk with the manufacturer, they said that they are more interested in selling their vaccines to the national government.
But if COVID-19 vaccines will be commercialized next year, the government assures there will still be a portion that will be freely accessible to the public, especially in poor communities.
But definitely, like in rubella, tigdas at saka yung polio, meron pa rin portion tayo sa gobyerno na ibibigay, lalo na sa mga bata at lalo na sa mga matatanda at saka doon sa mga poor communities na hindi kayang bumili ng bakuna.
The current COVID-19 vaccine stockpile of the government was only approved for emergency use. Presently, the national government is focusing on providing free vaccines to Filipinos. Additional drugstores and clinics are added today as part of the pilot launch of Res Bakuna sa Butika program of the government, which aims to provide more vaccination sites for those who will get their booster dose. Meanwhile, the government is also mulling over establishing drugstores and pharmacies to serve as testing facilities.
Possible yon, kaya lang, ang kailangan pag-aralan ng mabuti yon, no? Kasi kailangan ang kinakatakot ng mga doktor natin at mga eksperto natin, yung infection control, no? Kasi baka magkahawaan, no? Dahil nga hindi naman talaga made for testing laboratory ang ating mga butika, no? Yung bakunahan naman kasi safe naman yan, no? Hindi kamukha ng testing na merong merong mga sample, no, na kinukuha sa ating mga kababayan. So, pag-aaralan ng mabuti yan, pero kung kaya natin gawin in a safe way, bakit hindi?
The NTF against COVID-19 is expected to present their assessment of the newly launched Res Bakuna sa Butika program to President Rodrigo Duterte on Monday. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
The Order of the Golden Heart to World Health Organization representative to the Philippines, Dr. Rabinda Abeyasing. For almost 3 years of being the WHO representative to the Philippines, Dr. Abeyasing has immensely contributed to ushering health initiatives and achieving milestones in the country's health system. The WHO aided the Philippines in its fight against polio through the provision of both technical and operational support in intensifying polio surveillance, which resulted in the closure of the polio outbreak on 3rd of June 2021. Dr. Abeyasing also has supported the Philippines in its pursuit of universal health care, ensuring that other health concerns are not neglected while the country responds to the unprecedented effects of the COVID-19 pandemic. In a statement, Health Secretary Francisco Duque III said, "It was an honor working with inspiring and dedicated WHO country representative amidst the COVID-19 pandemic." Secretary Duque also said that with the tireless support of Dr. Abeyasing, the Philippine government was commended by the WHO Director General for swiftly executing redoubling efforts in strengthening routine immunization of children. The Order of the Golden Heart is given to organizations or individuals who have greatly contributed to the social, economic, and moral improvement of society. Dr. Abeyasing will end his tour of duty and is set to leave the country tomorrow, January 22nd, 2022.
And for the news abroad, approval rating of U.S. President Joe Biden reached its lowest rate after taking office in January last year. Ani Mancilla will tell us the details live. Good evening, Annie.
Good evening, Kath. After maintaining approval rates of over 50% in the initial months of his presidency, this week's national poll from January 19 to January 20 revealed that 43% of adults in the U.S. approve of President Joe Biden, while the remaining 52% disapprove and the rest unsure. Just a week before, President Biden's ratings were 45% approval and 50% disapproval. His popularity began to decrease last August due to the U.S. pulling back from Afghanistan, as well as surges in deaths due to COVID-19. The polls have continued to indicate the impact of the pandemic, as Americans have put forward their concern regarding the problems of the COVID-19 pandemic and its toll on the economy. But in the recent press conference on Wednesday held by the president himself, President Biden expressed that the Omicron variant, though challenging, should not be a cause of panic as the country is prepared. Adding to that, believing in the effort of his government recognizing that they have reduced deaths due to COVID-19.
The fact of the matter is that we're in a situation where we have made enormous progress. You mentioned the number of deaths from COVID. Well, it was 3 times that not long ago. It's coming down. Everything's changing. It's getting better. Look, I didn't overpromise, but I think if you take a look at what we've been able to do, you'd have to acknowledge we made enormous progress.
Back to you, Cass.
So, Annie, what's the thought right now from the Democrats?
Kath, this decrease in approval rating has, however, increased concerns among the Democrats, as they think it may cost them the congregational majorities in the November 8 elections. A handful of Democrat strategists have explained that President Biden needs to aim to deliver a more economic-focused message which also targets the pandemic and help the affected families. Kat?
Thank you, Annie Mancilia, reporting live from Singapore. Havana syndrome, a mysterious illness among U.S. diplomats and government officials first discovered in 2016 in Havana, Cuba, speculates that countries who are U.S. adversaries could be responsible. However, the CIA looked at the majority of 1,000 cases and found that this sickness could be due to stress or natural causes. Authorities had not found any evidence that it is a weapon or attack done by another country, which disappointed and angered those who fell ill. Symptoms of the illness include dizziness, headaches, and an intense and painful sound in their ears that last for months, which causes fatigue to those who experience them. Recently, new cases in Geneva and Paris have been found, and Secretary of State Antony Blinken said that the U.S. government has been investigating the cause of this phenomenon. Approximately 30 companies in the United Kingdom have announced participation in the 4-day work week trial. Nerissa Dando will tell us why live. Yes, Nerissa, go ahead.
Good evening, Kath. The launch of 4-day work week in the UK is believed to alleviate low productivity rate, overwork, high carbon footprint, and high unemployment rate, according to the Center for Local Economic Strategies. A trial period for 6 months to participate in what is becoming a trend in many corporations worldwide have been recently launched through a campaign called 4-Day Week, where employees will work on reduced hours. Companies participating in the trial will reduce the employees' work hours to 32 work hours per week compared to a current maximum of 48 work hours starting June 2022. Between 20 and 200 employees are expected to join the trial, which will also include productivity and well-being measures. No loss in wages are anticipated as remuneration remains the same. The 4-day work week is set to challenge the current norm and for companies to slowly move away from simply measuring how long an employee stays at work to full productivity-based measure. Kath?
Thank you, Nerissa Dando, for that report live from Japan. An X-ray technology capable of detecting COVID-19 that is 98% accurate and much quicker than a PCR test has been developed by a team of experts in Scotland. Jane Robles will give us the details live. Yes, Jane?
Kath, the new technology was developed to relieve pressure on health systems, particularly in countries where PCR tests are hard to source. Professor Naim Ramzan, the leader of this project and director of the University of West Scotland, said the need for a quick and reliable tool that can detect COVID-19 has become even more true with the upswing of the Omicron variant. Thus, the X-ray technology could prove to be crucial and potentially life-saving, he said. However, it cannot fully replace PCR tests, as the new X-ray technology cannot detect COVID symptoms during the early stages of infection. The study used a database of around 3,000 images belonging to patients with COVID-19, healthy individuals, and people with viral pneumonia. Then, an artificial intelligence, or AI, is used to analyze visual imagery to make a diagnosis. Kath?
Jane, which countries are experiencing PCR test shortages right now that this new X-ray technology can be used once it's rolled out to the public?
Kath, there were concerns about PCR test shortages in England. Towards the end of last year, the availability of PCR tests there struggled to keep up with increased demand over the holidays. There are also COVID test shortages in the US early this month, due to increased surge of Omicron variant, particularly in Virginia. Officials in the U.S. said there's been also chain of supply disruptions. Kath?
Thank you, Jane Robles, reporting live from Vietnam. And those are the reasons behind the news in other parts of the globe. I'm Kat Dumaraos, live from Bangkok, Thailand. Good evening.
With a word giving glory to God from the book of Proverbs, chapter 21, verse 13. It says, "Whoso stoppeth his ears at the cry of the poor, he also shall cry himself, but shall not be heard." Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.